we'll have so far. And we can, get started with recording this, and then we might have a few people joining us in the next couple minutes. But thank you all so much for getting on our call. I know we had a little break last month for July, and we're ready to get back to it so everybody can move officially now. So really exciting. We've launched the new name, new brand. And I think the first item on our agenda really is to talk about that and kind of give everyone an update on the branding, the logos, and the website as well. And so I'll quickly kind of just go through, kind of share our brand guidelines document. And won't go over it in super detail because you'll all have access to this in the resource folder that's going to live as part of the toolkit, and Kyle Stepp will be kind of revealing the toolkit today to you all. So really excited for you guys to see that. We've been hard at work with Kyle's leadership on that toolkit, and excited to share that with you. But if I can share my screen, there we go. Here is our brand guidelines document. Can you guys see this okay?
Yep.
Awesome.
Yes.
Yep.
Yes.
Great. So I'll just kind of go through each of these pages a little bit, but everyone will have access to this. The reason I'm sharing it is so everyone has a general sense that of what our kind of visual identity is, that as a state, if you are working on creating any documents or fact sheets or your kind of marketing communications teams, that you'll have access to this document so that we can all be following the same kind of brand guidelines together. In this document, we also have our tagline, our mission statement, and our vision statement so that we can all be on the same page in terms of what we're working towards. And then we've also got kind of our brand positioning in terms of what So Everybody Can Move is all about. I won't go through and read through it in detail here. I'll give everyone the opportunity to read it on your own time. That way we can kind of stick to the highlights going through this, but in this document it shares kind of our logos, our primary logo, alternative secondary logos, how those can be used. And then additionally, we've got our state logos as well. So I'll kind of just go through these ways that we kind of advice of how not to use the logo so that we can make sure we're all sticking within the same format. Of course, not doing any kind of sideways or cutting things off, or using colors that we aren't in our packet. We've got our font and typography in here. These are our colors as part of the So Everybody Can Move brand. This part here is part of ADA compliance, so that can share with whoever your designer is in terms of what colors you're allowed to use together, because that's specifically for individuals with visual impairments or color blindness, so that we can make sure that we're using the right colors with kind of they're paired up with the right ones so that people can see what you're putting on documents. And then we've got the hex codes on here, as well as the CMYK for printing that they can use as well, which is great. And then kind of showing how the logo can be used on various kind of color palettes. And we've got multicolor versions, and we'll have a folder of all of these logos for you guys to use in your documents. And then, of course, probably what you all are most interested in is seeing the logo specifically for your states. So we did a survey back in, I believe it was June, to ask everyone kind of your preference. And overwhelmingly, everyone wanted to kind of go with the So Everybody Can Move and then the state name underneath. And so that's what will be in the folders for you all to use for each of your states. Kind of some advice here in terms of co-branding, what to do, what not to do. Again, we'll share this out with everyone. And then kind of, this has been a cool aspect of this brand, is really taking this like everybody, parallelogram and being able to use that as part of the brand moving forward. So we're excited to share how that's going to get translated to the website as well. So that's pretty much kind of the application. These are some applications of how the brand can be used. We've got this great imagery as well. So really excited with how the brand has come together, and think that it'll be a powerful way for us to represent this initiative. For the website, we're planning to have that available probably mid to late September. We've had it kind of pushed back a little bit just based on everything going on this summer, but really excited for that to get launched and for everyone to be able to use that. Potentially, hopefully at our next call, we'll have that, or we can share a sneak peek of how it's coming along. And for every state, there will be a state page. So if you have some photos of your team that you would like to live on that page, please share that with us ahead of time, and we will get those loaded. And then we'll have kind of updates on where your state is at. There will be a map so people can easily, click on and be color coded to see where states are in the process. And think it'll be a really great opportunity for us to have some visibility and just credibility to the initiative. And of course, most importantly, a way for people to donate back to the initiative as well, and for us to be able to use those funds to help all of you. So that's kind of just a little bit of an update on that. Again, I'll be loading in the brand positioning, brand guidelines document into our resource folder. And along with our logos as well, you'll all have access to that. And that resource folder can be found in our toolkit. So I'll kick it off to Kyle to do a reveal of the advocacy and lobbying toolkit that has been developed for you all.
Awesome. Thank you so much, Nicole. I'm going to share my screen now. I definitely want to thank everyone. So this was truly a collaborative effort. I think over the course of, the past, it feels like longer than 6 months, but over the past 6 months, this guide has truly been created because of many of your feedback, and especially our teams in Colorado, Illinois, Maine, Arkansas, that have in Indiana that has introduced legislation. It's been going through this process, and really your experiences and your best practices are truly how we created this guide. And for many of you, you all have raised your hand and asked tons of really good questions and provided a ton of phenomenal feedback to Nicole and the team at AOPA. And so really being able to take all of that information that, we've been able to compile into this comprehensive guide. And so in this guide is really designed to be built with strategies for engagement and raising awareness, but also the opportunity for you all to understand how do you influence laws. But this guide is designed for both new and as well as experienced individuals. And so what you'll see in this guide is essentially a 6-step process. And so throughout this guide, it's really, sorry, there are so many pages where you're jumping around where I'm trying to get to the page that says the 6 steps. And so in this guide, it's really built to be 6 steps to success. And throughout the guide, you're going to be able to see each stage of your process, from the beginning of how you build a coalition to understanding of how you influence the legislative process, and as well as your marketing and communications efforts. But throughout this guide, what's really awesome is that you're going to see sections that really highlight resources that are going to be available for you to be able to achieve or be able to accomplish that step. We recognize that this guide is intended to be flexible and adaptable, and it varies from each state's bandwidth and timelines, but recommending that you do follow all 6 steps in order to be successful. This guide is in beta version. I think that's really important to note. As we're going through this guide, is we want to hear your feedback. Many of you will be utilizing this guide from step 1, or some of you may be already at step 3. But really want to ensure that we get your feedback and your perspective, is so that we can continuously evolve this guide. In addition to this guide, you're going to have access to some really phenomenal additional resources so that you can be educated on a deeper insight into the O&P insurance coverage and policies that impact it, as well as templated resources for not only your testimonies, but also templated resources for marketing and communications. And so similar to Nicole, not going to go through this entire guide because you'll have the opportunity to review this, but essentially it is a clear 6-step process on how you can work through your legislative process in your state through the best practices that have been shared from some of our other coalitions across the country. And so so that we'll have access to one centralized resource folder. When you see at the bottom of each section where it says resources, it will highlight the resources that are available in that section. Like, for example, in step 3, starting the legislative process, you'll see examples of written testimonies, example of recorded testimonies, technical assistance, and example phone call and email scripts, which will all be in one resource folder. And so definitely utilize this throughout your process. Really is meant to help you work through expanding your legislation and hopefully getting it passed. One thing we recognize is that every state's process may be a little bit different. So that is noted in this guide, but it's really, these 6 steps are pretty transferable from state to state. And so provide any sort of feedback that you may have throughout the process.
Awesome. Thanks, Kyle. Actually, if you wouldn't mind going back, sharing it again and going to page 6, I just wanted to highlight for individuals that in addition to having kind of the 6 steps to success, there's a few pages in here that really dig into the narrative of what the problem is, how this legislation fixes it, and kind of talking points on disability rights and access. Has some kind of key statistics, and just wanted to share that's at the beginning of this document, as we felt it was important for individuals to have a little bit of light reading material in a sense, to dig into what this initiative is all about. So I just wanted to highlight that that's at the beginning of the document as well. And
hey,
Cheryl,
I just want to say that is amazing, you guys. Thanks for your efforts. I mean, for us trying to pull it together and then having something like this that is just a step by step with all of that information in there is incredible. Thank you so much for all your efforts. That's just amazing.
awesome. Thanks, Julie, for that. And yeah, we're excited for you guys to use this and hopefully see yourselves in it as well. We tried to use as many photos from all of the different states as we could, and we're excited to get more photos from you all as well as you do this work in your individual states. So really, this toolkit is because of all of you and just the collaborative effort and knowledge sharing that you guys have all shared with us as well. So a big thank you. And Cheryl, I see you've raised your hand.
Hi, yes. So, well, first off, I want to echo the last sentiment that this is fantastic. And I know that there was a ton of hours and effort that was put into this. So thank you to the AOPA staff and thank you to all of the advocates that have really put this together for those of us who are going through the process now, especially with different levels of resources. Just if we did have questions to follow up on any of the information or any feedback, does that go to advocacy at AOPANet or does that go to you, Kyle? How do you want us to handle that communication?
Yeah, good question. We'd love for you to send that to the advocacy email, and as well as who is your main point of contact that you're working with directly as your state coach, whether that is either Nicole or Sam. But we would love to compile as much of your feedback as possible, and based on who you're working with at one of the national partners. So I will be there to support after the feedback is received, but if you don't mind sending it to them, that'd be really great.
All right, perfect. Thank you.
Thanks, Cheryl.
And on that note, just to clarify, as this is somewhat of a new concept that we are creating with our national partners, NAOP, the Amputee Coalition, and the Academy. But this idea of having kind of state coaches is something that's in the work, so that kind of each state would have a national contact from one of our partners that you're going to work with. As we found that, you know, this document is very helpful, but it can't kind of live in isolation, and we want to be there to support you guys as you have questions through the process, and just to have someone that you can, you know, bounce things off of, or that can help keep you on track. So definitely want to kind of reiterate that that's still a little bit under development. So if you don't have you're unsure who your state coach is quite yet, we're working on that, and we will be rolling that out so that you know who your contact is. But in the meantime, reach out to the advocacy at aopanet.org email, and we'll get you sorted. So
I definitely want to highlight what Joy said. This has really been also a big collaboration amongst our 4 initiative partners. And so all 4 have really shared different insights into ensuring that, we do create the most effective guide. And especially from our technical support from our friends at NAOP and the Academy and the Amputee Coalition, to every single one of you. So thanks again, everyone.
Awesome. Thanks, Kyle. And if anyone has any additional questions on that, feel free to drop them in the chat. Herb, I see you're raising your hand.
Yeah, just very quickly, and when will we be able to get our hands on the first version, the draft version,
Of this toolkit?
that which you just presented?
Yes,
Is
right
that going to
after
be
this,
available right away?
right
Yep.
after this call, we'll send it out. Yep, so it's ready to go. And we'll have the logos and everything as well, that will link out for everyone. So, awesome. The next item on our agenda wasn't originally on our agenda, but we've added in, wanted to give a little bit of time to Shanice. In addition to the toolkit as something that we're offering to the states as a way to help, we are also offering the opportunity for states that are introducing legislation in the coming year to have a fiscal and social impact report created by Shanice and her organization. So would love to just give, and I sent out an email yesterday to those states that have indicated that they're going to be introducing legislation, either have already introduced it in 2023 or working on it in 2024. I think we've got about 10 to 12 states that are on that short list. And so Shanice and her team are going to be paired up with you guys to develop that fiscal and social impact report, which will be huge, not only for your specific state, but as a movement, we will be able to compile all this data together. So Shanice, handing it off to you to give a quick update on that.
Thanks, Nicole, and thanks everybody for the opportunity to continue to work on this. I'm super excited. It's been, to Kyle's mention and Nicole's, a huge team effort for our first social and fiscal impact report that we published in Colorado, Connecticut, and Illinois. Herb, I see you on here. We couldn't have done that one without you, but essentially we're going to do it again for 10 additional states. Again, Nicole mentioned the email to those advocates was sent out yesterday, but I can roll through them real quick for awareness of the group. It's Minnesota, Florida, Connecticut, New Hampshire, Tennessee, Ohio, Oregon, Idaho, Maryland, New Jersey. We're working with additional states to see what we can do to support them. So if your state is not on that list, don't hesitate to reach out to either Nicole or myself to see what we can do to support. The rationale for the 10 states essentially is around, the type of payer that they're looking to go after and priority for parity, i.e. insurance fairness, tacked on with so everyone can move in that recreational sense. But again, if your state's not on that list, it doesn't mean we're not willing to help out. In fact, it's quite the opposite. So feel free to reach out to Nicole. I did also put our new organization's website in the chat, and all of my contact information is on that website. You'll be working directly with myself and our new staff member, Joaquin, who brings experience as a data scientist. So we're really excited to have a group of 2 to support you all in your needs. And that, again, just includes that next publication, overviewing the per month per member cost and the overall net benefit. And then also we'll be offering testimony from that report's perspective. So really excited to work with you all, and happy to answer any questions if anyone has it.
Awesome. Thank you so much, Shanice. Does anyone have any questions on that at this moment? All right, Cheryl, I see you raised your hand.
Hi, so Shanice, I know, so I am guilty of reaching out to you way too much. I'm just excited. So I guess I know like you are one person and I'm just glad that you have someone else working with you, but how do you want us to coordinate with you moving forward with what you're going to be doing? Do you want email? Like, how do you want us to coordinate with you for all of this?
I think that's an amazing question. I'm still working with AOPA's leadership on finalizing the details of that within our agreement, but my initial thought was kind of having office hours every month for you all to jump on and ask for updates. I also will be providing an email update of where we're at with the report. The goal is to have all of those states that I mentioned, their analysis in that single publication published by the end of this fiscal year or the calendar year. That way everyone's set up before your legislation session starts. And again, we're still working through all the dates. So if that triggers anyone to say, hey, my legislation session starts before December of this calendar year, please let me know. But office hours is on the table. I'll be sending out an email to all those states as a follow-up from Nicole's probably next week once we get those details finalized. But in the meantime, email is great. Also, if you have my phone number, you're welcome to reach out. Cheryl, I love ping-ponging ideas. So you continue to reach out what you need. You give me more ideas.
I really appreciate it. Thank you so much again for your assistance with all this.
No problem.
Peter, I see you've got your hand up.
Shanice, sorry I was a little distracted when you were in the beginning of what you were saying. Where are you getting the data to do this all? Is it one central repository?
Great question. We're going to attempt to collect all payer claims database from their database at each state level. Some states don't have that database, and the majority of them will likely cost funds. So we're going to work with the legislative sponsors to see if they have funds to support that need, like we did here in Colorado. If that data is not available, we'll do what we did in our report previously, which is essentially taking an actuarial report and applying US Census Bureau data to match the population of that state. And I go through the methodology in the first report. It does get somewhat complicated. So if that's something folks are interested in, I can definitely do that in the first office hours, because it helps, especially from an advocate's perspective, to speak to some of those details. So that can definitely be on my first agenda if that's something you're interested in. Definitely going after data.
You may want to consider recording some of those office hours, depending on how formal they are, because you don't want to be in a situation where you have to repeat the same thing over and over and over because someone wasn't available at that time. Just a thought. Thanks.
Oh my gosh, that's amazing. No, that's a great idea. Thank you for that.
Awesome. Thank you, Peter. I think that's a great idea. And to kind of save on your time as well, Shanice, the more we can record and send it out to people to get at their time. I also dropped the link to that first report in the chat if anyone is interested in looking at that. So.
Yeah,
Great.
perhaps maybe we can even add that to the next iteration of that toolkit as just a link so they can review the methodology. That's a great idea. Thanks, Peter.
Sure.
Awesome. All right. Moving through the agenda, the next item we have, I'm going to hand the mic over to Dr. Susanna Engdahl, who's on our IOPA team, to talk about a survey that we are working on as part of this initiative to gain better access to data in regards to barriers that individuals with limb loss and limb difference have in terms of getting access to O&P for physical activity. So I will hand the mic over to her. This is kind of an action item that we would love all of your help on as part of this.
Thanks, Nicole. Nicole set this up really well. As she said, our goal here is to really try to start putting some numbers around barriers that you all might have experienced in your individual states towards participating in recreational activities, or more specifically seeking care for physical activity devices. So the hope here is that we can publish a nationwide report, but hopefully if we get sufficient data in each individual state as well, that we can actually break those numbers down for you for use in your particular advocacy efforts. So over the last 7 or 8 months, we've been putting together this survey with the intent of doing that. And we have now officially launched it and are looking for people to help take it. So this group obviously is a great resource to help get that ball rolling. I'm going to put the link in the chat for you all if you're interested in taking it. For those of you who have other contacts outside of this group, whether that's friends or support groups, or if you work at clinics or anything like that, where you may come into contact with a lot of people who have limb loss or limb difference, we can also provide you flyers to distribute to those individuals as well. So if you are interested in doing that, please feel free to contact me or anyone else on the IOPA team, and we can get you set up with that. The last point I just want to clarify, this survey is open to anyone who has limb loss, limb difference, or limb impairment. you do not have to currently be using a prosthetic or orthotic device to participate. It's also open to parents of children who have limb loss, limb difference, or impairment. So we would really like to, cast as wide of a net as possible in terms of quantifying different types of experiences that you all have had. So I'll leave it at that, but happy to answer any questions that you might have right now.
Awesome. Thank you, Susanna. And if anyone has any questions on that, looks like looking for the link in the chat. Thanks for sharing that, Susanna. It looks like there's a question on a deadline.
Just Nicole, real quick, it's Kimberly.
Oh, hey, Kimberly.
What's the goal, or you and Susanna, what's the goal of the survey? Are you going to quantify it, then publish it, and that'll be another tool to use, or what's the goal for that? I'm sorry,
Yeah,
I didn't know about it, so I'm just curious.
Yeah, exactly. The intent behind this is to give you all an additional tool that you can use in supporting your advocacy efforts. So there was a question in the chat about the deadline for the survey. We are keeping it fairly open for right now. We'd like to hopefully collect around 250 responses or so over the next 2 or 3 months, but depending on the response we get, we can certainly leave that open longer. And again, depending on the rate that these responses come in, we may also be able to start distributing preliminary statistics and findings that may be helpful for specific states. But ultimately, the goal is to publish a final report.
Absolutely. And I just kind of want to reiterate too that there's not a lot of research on this topic. And so having the ability to create something like this and having Susanna's work will be significant to our efforts. And of course, we can only be as successful as all of you guys kind of chipping in to help and getting the word out and asking individuals in our community to take it. I think trying to get to 250 individuals to take this is a pretty ambitious goal, and we definitely will need your help to get it out to the right individuals to take it. So we appreciate that.
And one other thing that I should have mentioned, I skipped over this. This is intended to be a short survey. It should take only about 10 minutes to fill out. So it's not intended to be a huge burden on those of you taking it. You will also be eligible to win a Amazon gift card if you complete the survey. So, if that changes your mind on this at all, I just wanted to throw that out there as well.
There was a question in the chat from Joshua. Is there any statistical significance with 250 responses?
Not directly. Certainly, if we're talking about pulling together statistically significant findings for all 50 states, that's actually probably a low number. Again, depending on the response we get, this may not pan out for every individual state, but certainly we can publish national trends as well. 250 was really just a starting point to really make sure that we were getting a robust response on this. So if we go over that, if we go less than that, there's still some, we'll still be able to get meaningful results from this.
Great. And then can you touch again on how long the survey will be open?
Yeah, of course, we don't have a set closing date yet. Our goal is to probably keep it open for the next 2 to 3 months, depending on the response we get. If we're not seeing enough activity or responses coming in within that timeline, we can keep it open a little bit longer. But because the intent is to publish this report for you all to use, we don't want to keep it open indefinitely.
Yeah, and on that note, we did a little bit of a soft launch of it at the Amputee Coalition conference, and we're inviting people there to take it. So if any of you all are going to be at specific events and would like to team up with us and be able to have individuals take the survey at that event, we would love that. So just let us know if that's an opportunity in the future for you. And Cheryl, sorry, you've had your hand up.
Oh, no, fine. Well, I was just going to say a possible way to try to get responses is for those of us who are clinicians, when patients come to our office, oftentimes if we are going to make adjustments to their prostheses, replacement sockets, et cetera, perhaps we can share the information. The patients can just complete the link while they're sitting in their offices, while they're waiting for us. Just will help pass the time win-win. So just a thought.
I
Yeah,
love that.
absolutely. If you are in a position to offer this survey to your patients, we'd absolutely be happy to send you flyers or any other information that would be helpful in that, helpful with that. So definitely let us know.
Yeah, I think that's a great idea, Cheryl. If anyone has that opportunity, I know I've sat in many waiting rooms, just twiddling my thumbs, waiting for, the leg to come back from the back. So definitely have some opportunity to capitalize on that time for individuals. I think that's a great idea. Awesome. Thank you all so much. We'll send out some more information on that as well. And then the last action item we have, I want to invite Kyle and Dee to chime in. The three of us have been co-captains on our Hood to Coast team, and our team is going to be racing next week. So for those of you who don't know about this team, we've got 12 athletes with disabilities who are going to be doing a 198-mile relay race from Mount Hood to the Oregon coast and Seaside next Friday. We start at 4:30 in the morning, and we'll be going all day until the next day, until the afternoon. And our goal is to, our team is so everybody can move, and we're raising awareness for the initiative and also funds for the initiative as well. So I'd love for Kyle and Dee to share anything that they'd like to as well on that.
Great, I can go. Can you guys hear me? Okay. Okay. So even though the race is in Oregon, we're really fundraising for the whole initiative. If anyone wants to share the fundraiser on their social medias, email their friends, we would love your support. Also, it's a really good way to kind of individualize it. You can say, I'm a lead in Indiana, they're fundraising for the initiative, and this will really help me do so. Yeah, so it's kind of a way to get out there, kind of put your personal touch on it and what you're doing in your state, as we're kind of doing it for, all the states in the future and everyone out there right now on this call.
Awesome. Thanks, Dee. Kyle?
Awesome. Really excited for us to be able to use this, especially for raising awareness about the initiative. One thing that Nicole brought up, but a lot of people don't know, is that less than 1% of individuals living with disability have participated in Hood to Coast. And so last year, our team was the first ever all adaptive team, and we're continuing seeing that momentum. So hopefully, challenging the system to create more access. And so over the course of next week, you'll see a lot of the team members even sharing more about their experience and why access just to the starting line is important. I think to get to the starting line is a feat in its own, especially for any athlete. And now, you all know better than anyone, getting to the starting line is beyond a privilege for our community. And hopefully one day it could become a right. And so really excited. We have some amazing partners. If you know of a company or an organization that would love to sponsor the team, we would love to collaborate with them and highlight them through our marketing efforts, as well as the media coverage that we will be picking up next week. And that's the other thing. If you have any strong relationships with media outlets or publications, we would love to collaborate with you. Our effort next week is to really highlight this initiative and talk about the states that are in the works. That's really important for us through this initiative, is really recognizing, because this is a race that we have athletes from all over the world, but especially from all 50 states will be participating. And so we'll be really elevating the work that you all are doing currently on the ground in your states. And so we're excited. The social media is launched for So Everybody Can Move. Can't even tell you how hard that was to get an Instagram account, and Nicole and I can tell you about that later. But if you would love to follow along next week, it's at So Everybody Can Move. So please follow along. We would love to, you can get to know the 12 athletes that will be participating in the movement.
Yeah, and just to share some context of this relay, it's the largest running relay in the world. There's 20,000 people that do it. So for us to be a team of 12 people with disabilities and really the only individuals on the course with disabilities, less than 1% of the people doing this relay have disabilities, we're definitely making a statement and in terms of access. And more than that, really trying to hammer home the messaging behind us not even being able to have access to what we need to have from prosthetics or orthotics to be able to compete in these types of events. And I dropped a link in the chat that kind of has our team page. We're working to fundraise $50,000 for the initiative through our teammates. And if you want to get to know a little bit more about our teammates, these are each of our individual teammates that are really, as Kyle mentioned, coming from all over across the country and helping to raise awareness through their own social media platforms and communities as well. So we'd love your support in getting the word out on our team, and just thank you guys so much for cheering us on next week as well. It'll be a fun 36 hours pushing through. So we're hoping for some good temps as well. This past week, it was 106 degrees here. So we're hoping that it's only in the 80s next week. So.
And the last thing I'll say is we would love just to thank again, we are really lucky to have On as our partner. So if you all get the opportunity, if you ever, if you follow On social media, share some love with them in their comments and recognize them. On is a reason why 100% of the athletes fundraising can go back to the initiative for us to support our states with more resources. But that's because of their Right to Run program. That's their social impact extension of On Running. And so again, just really want to make sure we highlight them and really appreciate them. We hope to continue working with them as a partner beyond this year, and excited to see what that looks like.
Awesome. All right, well, I know we've got 20 minutes left in the agenda and want to give an opportunity for the states that are on the call to give updates on where they're at and to kind of share some knowledge that can benefit everyone as part of this process. So we'll start with the states that have enacted their legislation or are working on implementation at this point. Exciting that we have 5 states now officially that are part of that list. So if Francois, if you're on the call, would love for you to give an update on Arkansas.
Thanks, Nicole. All is well in the natural state. For us, currently we are in the process to test the law. We have 2 cases that now, one being submitted through Blue Cross Blue Shield. For those who don't know, Arkansas also not just for activity prosthetics, but they also passed the law to allow for shower specific prosthetics. So one of the test cases is going to be trying to see what happens if we do the shower prosthetic. And then our second one is for a water specific activity prosthetic. So Blue Cross Blue Shield said that they don't need prior approval. So we'll go through that process, and then we're in the process of waiting on United to see if they will approve the activity prosthetic.
Awesome. That's amazing, Francois. And for individuals that don't know, Arkansas is the first of the states to go into effect. So the law went into effect on July 1st. And I believe New Mexico and also Maine go into effect January 2024, and then Colorado and Illinois go into effect January 1, 2025. So you're really leading the charge for us, Francois. And we appreciate what you guys are doing, putting in these test cases. That's amazing. We're here to support you with that.
Thank you.
Francois, it's Joe McTurnan. Can I ask a quick question?
Sure.
So did you say you have the 2 test cases? One is Blue Cross Blue Shield, and then a separate one is United. So they're not both Blue
Correct.
Cross.
Correct.
Okay.
Yep.
Yeah, that'd be really interesting to see what happens.
Awesome. All right. And I know, Francois, we've chatted before about potentially testing or piloting a concept of doing a mobility day of sorts to really get the word out to individuals so that they know their rights and that this has happened in Arkansas. And we're kind of still working through that on our end, but we will loop back in with you so we can do that together. We're excited for that to happen.
Very well. Thank you.
Awesome. All right, we've got Colorado, and I believe Jeff Kane is not able to attend. And Angela, are you here to give an update from Colorado? Awesome. I see
Hey,
you on
Nicole,
here.
I am
Hey.
here. Can you hear me okay?
Yeah, we can hear you, Ange.
Okay, great. So we, first of all, awesome work, everybody. I really loved, you know, all of the hard work that you guys have put into creating this toolkit, which is something we've all been talking about for so long, and it's actually crazy to see it come to fruition. So kudos to you guys. I think, and I'm also really excited to hear about Francois and his, you know, the test cases. That's kind of been the big topic of discussion here in Colorado, is just implementation, what it looks like, and all of the steps that need to happen before then. So personally, I'm very happy that we don't go into effect until January of 2025. It feels like there's quite a bit of work that we have yet to do here to get organized. So it will be more of a plug and play come January of 25. But since we had our last meeting, not much has happened here in Colorado. We've been trying to get a meeting with a few folks to help us determine the appropriate steps to start conversations with Colorado State Medicaid, but a lot of people were gone over the summer, so it was hard to get a meeting together. So I'm hopeful that in September that meeting will be able to happen, which is basically just advising us on the appropriate steps and strategy to have that conversation with Medicaid. And then other than that, Coalition is having an academic meeting at the end of October. And in that meeting, we're going to a breakout session to discuss concerns from the field or ideas, suggestions, thoughts on implementation of this. It's been a hot topic here, and I've gotten a lot of traffic about, so you pass this bill, how are you going to, now what happens, or what's going to happen next? So I think it'll be great to hear, have a think tank of sorts around what people's concerns are.
Love that. I think that is a great idea. And thank you guys for helping to lead that.
One other thing, Nicole, is that we are trying to pay up our debts of passing the bill. So we are planning on hosting a fundraiser this fall, but we do not yet have a location or a date. We're trying, we don't have any money, so we're trying to host something for free almost, and raise lots of money to pay up our debts. So for those of you who are starting this process, you know, certainly start raising your money now. I think we went around about this backwards because we had a lot of enthusiasm and momentum, and the timing was right to actually get a bill passed. I don't know if we believed it was going to pass this year, but it did and was wonderful, but we had to pay people to do that. And since we had no money as a coalition, we had to make promises that we would pay people. So we have until the end of this year to come true on our promises. And that's stressful, to say the least. So I think just know that it costs money to pass bills. And if you don't have money, either don't get into that arena yet, give yourself a year and fundraise, or, you know, be fundraising now in preparation for it.
Absolutely. And Angela, if you can let us know what that date is going to be, and would love to think creatively about, you know, whether we could partner with, I know Kyle and others are sponsored by Lululemon. So if there would be an opportunity to maybe host something at, you know, their store and do like a run, or get creative in something like that. And we're also working on some assets that we could maybe share at an event like that, like a film or something. Would be happy to, you know, be able to supply some collateral to kind of hype up people in the room, or even potentially be there in person to help you guys fundraise and get the word out. So let us know if we can jump on a call with you guys to think through finding a venue for free, and also some other ways that we can kind of elevate the conversation in the room and the people that are in it.
Yes. Thank you so much. I appreciate that.
Yeah, absolutely. All right, Jim, I know you guys have some exciting news from Illinois over the past couple weeks.
Yeah, we've been fortunate. we've actually had a really good summer. On June 1st, we had our 57 codes, Medicare approved codes added to our Medicaid MCO fee schedule. So that kind of helped front load actually the signing of the bill, SB 2195, that we had Governor Pritzker sign on August 7th. So we finally have that passed into law. Unfortunately, our implementation is kind of far down the road. We're going to try to move that up. I think we can negotiate that with the Illinois Department of Insurance. That was the only thing that we compromised in creating that bill, so we didn't have resistance going through, as we gave in with a January 2025 date. But we tried to do a public signing because of the, so kids can move. It's just a great story. We didn't get that, but we did get a really nice press release from the governor and from our sponsors, who really did a very nice job in explaining the bill, recognizing the medical necessity that they pointed out, that's going to help move this through so that it provides access, to these kids and to adults. After that, Bukola, she's in Turks and Caicos right now, our lobbyist. So we paid her to go on vacation. No, I'm kidding. But they are expensive. Anyway, we attended a couple of events for our Senate and House sponsor, at the end of this session. So we really have had a pretty good year here. We're pretty happy with things. Next year, we're going to try to address just an overall rate increase with Medicaid and the MCOs again. So you folks have done a great job in putting this together, Nicole, for everybody to follow the plan. If we can help in any way we can, we'd certainly be willing to do that. I had some discussions with our folks in Indiana, and we do have a good patient contact for Eric that I had mentioned last time. I had lunch with her a couple of weeks ago. She's actually a Shriners kid, and she's an attorney here in Yankton now, or in Chicago now. But she's very familiar with the legislature in Indiana. So I think she can help the folks in Indiana down there too. So that's kind of where we are.
Amazing. That's great. Thank you, Jim. Peter, I see you've raised your hand.
Yeah, Jim, congratulations to you and your colleagues in Illinois for getting that bill through so quickly. That's just fantastic work. I happen to know JB Pritzker from law school days, and haven't been in touch with him in 25 years, but plan on writing to him. And I'm quite sure he'll remember me. We had we knew each other pretty well back then. But I was just going to, be very expressive and thankful for what he did in signing the bill. But now that you're telling me that perhaps his essentially his administration through the Department of Insurance might be able to speed up the implementation of this, I think that's a much better letter to have an actual request rather than just thanking him. So right now the bill would apply January 1, 2025.
Right.
But it doesn't prohibit the bill from going into effect earlier than that. Is that
well? I think you're right there. Yeah, it doesn't prohibit it if we can get it moved forward, and we can get, I think some of the insurance companies may not really pay any attention to the effective date anyway. So any help we could get there, with Governor Pritzker and the Illinois Department of Insurance would be great. It's kind of ironic. I'm from South Dakota, and his wife is actually from South Dakota, just a small town about 20 miles from where I grew up also. So there's a good connection there that I had with his wife at one time. But yeah, Peter, so if anything we can do with that would be good, because we would prefer not to have to actually wait until 2025 if we didn't have to. I think we've got some ducks in a row that we can get that moving forward. Some of the codes that we had admitted to the Medicaid schedule just front end load this with the dynamic feet and flex feet that we got put into Medicaid and the MCO schedule. So it kind of loads, the L codes already for physical activity devices.
Yeah.
So,
well, happy to try to accelerate that. But, when you really think of it, 2025 sounds so far off. It's 16 months away.
Yeah, I know, and that's what they do. Yeah, exactly. We tried to get it for our fiscal year, which really starts July 1st.
Yeah.
But then the problem is the MCO's contracts don't go, they go January 1st. So we kind of made that compromise so that it hits the MCO contracts who are doing all of the administration of Medicaid in Illinois anyway. So
Okay.
that's kind of where we ended up with the January date.
Thanks.
Thank you, Peter.
Awesome. Thanks so much, Peter and Jim. We'll move on to New Mexico. Kyle, if you want to give a brief update.
Yeah, absolutely. So we're in our implementation process right now. We've been building a really great relationship with our Office of Superintendent Insurance. So our OSI has received the evidence of coverage from the different payers in New Mexico. And thanks to Joe and Devin's support and the rest of the team at AOPA, we've been able to work with our office to create a standardized language that's in the evidence of coverage. Our team, the best part about building the relationship with that office is originally when they received the first drafts of the 2024 evidence of coverage, our coverage for our bill was not in there. And so luckily enough, they were, when they were reviewing the evidence of coverage, they did notice it was missing, and sent out a memo mandating all the payers to put in the language. So excited now, we just reviewed the handbooks this week, and it was really special to see the language from the legislation, from the model legislation inside the handbooks of all of the rights for all the individuals with commercial plans in New Mexico. And then now is working is the evidence of coverage for Medicaid. And so because of the relationship with the Office of Superintendent Insurance, they're going to be taking the regulatory route. And so they'll be sharing with the payers that provide Medicaid in New Mexico the same standardized language to provide access to that one secondary device.
Awesome. Thanks, Kyle. All right, now we're going to be moving on to states that are have either introduced bills and are working towards the 2024. So at first we've got Indiana. Is Eric on the line? I'm not sure if Eric's on. So we'll skip over, and I believe Maggie wasn't able to make it to give an
I'm
update.
here, Nicole.
Oh, hey Maggie, would you
Hey.
mind sharing an update from Massachusetts?
Sure, yeah. So ours has a docket number and we're just waiting for it to be assigned to a committee. I've started working on the one pager. And sorry, I wasn't here for the first 5 minutes. Are we able to get that logo state specific now? Okay.
Yes,
So,
we've got that for you.
okay, great. So yeah, if you could just send that to me and I'll put it into the one pager. And Shanice, I'm gonna reach out to you and try to schedule something. I know ours is gonna be a little more complicated because it does include Medicaid. But probably best to get going on that sooner rather than later. And then the Massachusetts State Association, the Provider Association is meeting in early September. We're gonna be working on identifying patient advocates and just allied health organizations that will support the bill along with us, which I'm sure we won't have trouble finding. So yeah, we're in a pretty good spot right now.
Awesome. Thank you so much, Maggie. And wanted to share that I connected with Glenn and Posey at the Amputee Coalition National Conference. I think you know them well, but they were both really excited to get involved on this.
Okay, great. Yeah, and we will be reaching out to them shortly.
Awesome. All right, we're gonna head to New Hampshire and Senator Sue Prentice, if you're on the line. I'm thinking maybe she's not, so we can, if Peter, if you want to chime in, or
I have a quick update, only
Okay.
this is a few months old, but Senator Prentice is well acquainted with this bill, understands it well, has been a great leader in New Hampshire to try to get this across the finish line. Maggie and both Maggie and I have been talking with her in depth. I actually had a conference call with one of the key insurance lobbyists who used to be, I believe, the Speaker of the House or something, or the Majority Leader in the Senate in the delegation. But the fact is that They were supposed to come back with some alternative language to tighten up the language they had raised, the question about, is this an open-ended benefit, or is there some kind of, can you get 17 limbs for different activities that you do? And we answered the question, but I think it kind of killed it for that session. I expect Sue will be very interested in re-implementing this and reintroducing it when the new session is opened. I think 85% of that is accurate.
Awesome. Thanks for jumping in to give that update. All right, Herb, I know you have to leave right at 2, so I'd love for you to share Connecticut's update.
Good thing that my report is very short. Our activity over the summer is that we went to camp. There is a camp that was being held in Connecticut called Camp No Limits. It didn't start in Connecticut. There was also campsites in Maine and I think someplace out in the Midwest. But we were very fortunate to also have it in Connecticut. And what surprised us is there were a lot of out-of-staters that came. We had the opportunity to speak to the parents and to promote So Kids Can Move, which was fine back in July, because that was really the program we had. And guess what? All the parents that were there were really concerned about their kids more than anything else. So we had that opportunity and we definitely promoted it. We collected names and numbers, and we will use that in the fall as we really begin to ramp up. We won't be introducing legislation until 2024. And in Connecticut, it's a short session. By that, I mean, it starts in February and finishes in May. This year, it was a long session, which means the session started in January and finished in early June. So it's not a full-time job for the legislators. So we will do a lot of prep work in the coming months. And the prep work will include reaching out to our membership or our mailing list, looking for opportunistic photos that we can have, both of kids and, not so small kids, those who are physically active, to pose for photos that we can use in our own literature. We have a list of media people that we've already worked with because we got the bill passed. The original bill was passed all of 6 years ago, and it went into effect in 2018. So we have a, how would I call it, an outline already of what we need to do. We have a plan that we need to do. So we hope to get much more active in the coming months. And I'd like to make a comment about states that hired lobbyists and that you have to raise funds to pay them. What we did in the first time around is we didn't have a fund. We didn't hire any lobbyists. We were fortunate enough to be adopted, if you wish, by hospital lobbyist groups. And they did a lot of the lobbying for us. And this is something I'd be glad to get on calls with and to work with other people to see, well, how can you keep your expenses low? Because we kept it down to zero. The only thing that really cost us was gas to get to and back from the Capitol, as we are personally reached out and advocated it ourselves. And they knew we were not lobbyists. They knew we were advocates. And somehow that helped us in our efforts. So there is more than one way to skin this cat. And we'd be glad to talk to other people about our experience, which we really expect and hope to duplicate for the 2024 campaign.
Thanks so much, Herb, for sure. And then I think that is a great idea for states that might not have a budget for a lobbyist. If there is a group or sponsor that you can find that has a lobbyist themselves, to be able to team up with them and help make this a priority bill for them. Love that. Yeah, Kyle.
I was just gonna say that was something, Nicole, near the end of our process, we started receiving support from the Physical Therapy Association's lobbyists. So there are, thinking about when you'll see in the toolkit types of organizations that are often health related, those organizations are trade associations that almost always have a lobbyist. So building on that is a great partnership, especially the physical therapy associations or the hospital associations in the states.
Absolutely. All right, well, I know we're at time, but we've still got a few states left. So if individuals can stay on for a little bit longer, otherwise I know that if you have to go, you got to go. Thanks so much. So I'd love to give the mic to Arlene in Florida.
Hi, everyone. Congratulations, Nicole and AOPA staff. Amazing work. I'm going to pass it over to Caitlin. Caitlin is actually the lobbyist with RSA that's helping us in Florida to get this moving.
Thank you, Arlene. Like Arlene said, I have been partnering with her and her institute for the past several years here in Florida, and we're excited to kind of switch focus to the policy that you all are passionately working on. I'll be brief. Session in Florida starts in January with 8 committee weeks in the fall leading up to session. Our session is 60 days in January once it starts. That being said, bill drafting will open in September. We have 2 sponsors lined up and ready to go to sponsor the legislation. We do think that Florida will have an insurance bill this year that we will likely be able to amend the language into, but we have sponsors on hold just in case as the conversation moves forward. Additionally, we are working on a coalition called Pop Florida that Arlene is heading up to do grassroots and fundraisers to go through this process. We have our first call next week, so if anyone's interested in joining, please let me know. I can drop my my email in the chat, but otherwise that's the update we have for now. I look forward to working with you all.
Awesome. Thanks so much, Caitlin, for that and for dropping your contact in the chat as well. That would be great. Travis, would love for an update for Idaho.
Yeah, I mean, right now we've identified a possible lobbyist that we can use. I haven't really reached out, kind of waiting for the handbook because this is my first time doing any of this. Got to say that from what it looks like, I haven't been able to go through it yet, but what you provided is extremely helpful for someone who hasn't really done any lobbying or, you know, trying to go through legislature at all. So this is going to be huge. I think I've gotten some interest from the OMP community here in Idaho. Thanks to Nicole for sharing some of those contacts. Being able to do what I do for work, I think I have a lot of options to be able to connect a lot of the other OMP clinics in the area. And then we have a ton of athletes and people with limb difference that are interested, I think, in getting involved. So looking forward to it. Really have to take a look at some of the financials after hearing what people are saying today on what we're gonna have to pay some lobbyists. Obviously, that's gonna take into consideration whether we do push forward in 2024 or if it's something we got to gather the funds for first. But it's moving slow, but I think, you know, by the time we get to the end of the year, we will have everything in, at least ducks in a row to start doing the fundraising for this. So
Awesome. Thanks, Travis. All right, Cheryl for Maryland.
Yes, hi. So Maryland session is similar to what it sounds like Connecticut session is like. So Maryland session starts like the second week of January and ends in April. So we have a meeting set up with our potential bill sponsors. We were fortunate enough to have a senator who is not in the committee that our bills will ultimately go to, but she is kind of helping us network within the system. So we have a call set up in about a month that's going to include the senator who we're hoping is going to sponsor the bill, the delegate who we are expecting to sponsor the bill, as well as the deputy secretary for the Maryland Department of Disabilities, as well as the vice president of government relations for Blue Cross Blue Shield. So I am in the process of prepping for that call. We intend to have 2 patient advocates, 2 or 3 clinicians from more than one OMP company in Maryland, as well as 1 representative from AOPA on that call. And then prior to that call, I'm going to be sending out an email with the draft bill, as well as a link to Shanice's report that just has some of the previous PMPM information. So I want to thank a lot of the individuals on this call who have shared some of the resources with me. Some of our next steps also behind the scenes are I'm compiling a list of all of the OMP organizations in Maryland. We'll be sending them letters in hopes that they will sign on in support, so that way we can show the members of Congress that we have our support from all the companies throughout the state. I'm also going to be reaching out to the APTA chapter in Maryland and hope that they will also voice their support and possibly use their lobbyist for some help once we really get into this. But I spoke to the chief of staff for one of the senators yesterday. So our goal is to hopefully be able to have our bill pre-filed, which will hopefully bring it to the top of the list come January. And in Maryland, every bill gets a hearing. And the senator or delegate will actually work with us ahead of time to put together a panel of who would be testifying at the hearing. So we're moving ahead, just trying to figure out how we can tap into some resources in the state that we have, but not really sure exactly how to use them. So I'm working through that. And then any states that have gone the route of creating like a Gmail or just a central email account for collecting written testimony, that is something I'm going to be doing, and would love some feedback as to what you've made that email address, just so that way it's not too long, but it's also not confusing either. So thanks, everyone.
Awesome. Thanks, Cheryl. Great question. I believe Shri and Kaylee have both created Gmails, if they're willing to chime in or put in the chat what their handles are. And honestly, let's hand the mic over to Kaylee if you want to respond to that, and also give an update for Ohio.
Yeah, of course. So I think our email handle is just sebcmohio@gmail.com. And I'll put it in the chat too, just so you can see that written out. But for Ohio, we had our first meeting with legislator in July. We have bill language getting translated into Ohio Revised Code that we were supposed to have back this week, but our legislative contact is on vacation this week. So we're hoping I'll have it like Monday, Tuesday. And we have a couple more meetings scheduled with other reps to start building support. One of our upcoming meetings is hopefully our across the aisle counterpart to main sponsorship there. So we're excited to keep building. We also had our first coalition meeting with more than just like our leadership team. So we're building more network.
Amazing. Yeah, amazing work, Kaylee and Cheryl as well. Just on the past few months, you guys have put a lot of time and energy into this and have I can see you guys moving the needle on things, which is amazing. All right, Oregon, we've got Dee giving an update.
Hi. So we're working on finding a senator to pursue our bill. It's a 35-day session in 2024. So either we will try to push it this year, and if not, we'll have a great setup for 2025, I think. We think we can push it forward without hiring a lobbyist. But since people have been on the topic, if anything, we're hoping that either a, big sports brand or, any of those, those alleys will pop up and kind of support us with their lobbyist. But we're going to try without hiring our own as of right now. We feel like we can do that. Yeah. So no big updates.
Awesome. Thanks, Dee. All right, we've got Tennessee, either David or Joseph.
Yes, this is David. I'm going to be taking it. We, of course, you were part of it yesterday, Nicole. We actually had what I would consider our first official meeting and activity of getting things rolling and organized. But I think we potentially identified a lobbyist yesterday. We've got committees starting to form. We have good traction with several senators and legislators and other individuals outside of our industry. So all of that's looking up, and hopefully we'll within the next 2 months have solidified a lot of things for this legislative session coming up in this next year. As we've talked today, I actually have one question. Have the other states, do they form a nonprofit that actually spearheads this, or is it just a group of individuals that essentially is doing all this? I mean, obviously we're all coming together, but I was curious just from a legal standpoint if nonprofits form, because I was thinking about the branding and everything else as we had this meeting today, and like, should we create so people can move Tennessee?
Yeah, great question. We have not seen that happen yet in any state where a group has created a nonprofit locally in response to this legislation. I think the kind of better, not necessarily better, but an easier, more efficient approach would be to use any nonprofit entity that's already established within the state or association. So associations that are 501c6s can pay lobbyists. 501c3s can do that as well, but there's a little bit, a little bit more. It depends on how much funding is going towards lobbying versus how much the organization is bringing in. So a little bit easier to navigate the channels of paying a lobbyist through a 501c6 versus a 501c3. I would say the only unique case might have been Colorado, where they were forming the Rocky Mountain Orthotic and Prosthetic Coalition, basically at the same time as pursuing this, but they decided to form RMOPC really outside of just this specific legislative issue, but to be a placehold for Colorado moving forward into the future. So we would probably recommend that you, for more like longevity's sake or efficiency's sake, try to coordinate with an already established entity in the state.
Sure. Okay. And that's what we've been doing. I mean, obviously, I'm the immediate past president for the state society. So, and that's, I think, the banner that we're going to handle all the legal stuff and probably the fundraising. But that kind of just popped in my head, and I was curious if we should be pivoting on that or if it's what we've been basically doing. So thank you. That answers my question in that regard.
Yeah, absolutely. And I can, bring that back to our team and discuss further, but if that response or decision kind of changes, we can definitely let you know. But I know you guys already have kind of TSOP established, so that might be the best entity to go through.
Okay, very good. Thank you.
Awesome. Yeah. All right. So we've got our last update with Virginia, and Shri, I'll hand it over to you.
Hello. So we have a couple things happening with Virginia, including we are looking at introducing in January of 2024. So coming up in under 6 months, but we're also considering delaying introduction until 2025. Overall, we are in search of a Virginia champion to be a lead along with Jessica Norell and myself. This person would be someone actually living with limb loss and or limb difference, since neither her or I are. And we're also searching for, most importantly right now, somewhere between like 1 and 5 individuals, Virginia residents, who have approvals for a microprocessor knee as of January 1 of this year, when that law went into effect, because the champion that we've identified, Delegate Rome, who had introduced that legislation, that is kind of the standing barrier, but a very reasonable request for something before introducing something new into Congress. And then we learned that once we are able to pass legislation on all things so everybody can move, it will essentially make Virginia the most all-encompassing, state-of-the-art lead in insurance fairness, which is really awesome because it's kind of in that place already. So it has changed our dynamic of how important it is for us to include every type of detail in it. So we want to be the most all-encompassing, holistic possible we can when it comes to including what we want in the legislation. So that is kind of leading our potential delay in introducing to legislation. And then we are regularly meeting with VOPA, so the Virginia O&P Association. And like I put in the chat, if anyone knows anyone who's interested in getting involved, participating, funding, donating, or eventually going into Richmond, Virginia for any of the hearings, then you can email so VA can move at Gmail. That was before the branding guidelines. However, I was one that wanted the so state can move. So that's how that happened. That is everything for now. And we're really glad that we have kind of the beautiful luxury and the ability to learn from everyone else who is along with us in this process right now.
Awesome. Thanks, Sharina. It looks like Cheryl dropped in the chat a recommendation for you all. So thanks for sharing that update, and also just kind of in the trajectory of Virginia, where that would put you guys in relation to insurance fairness and other states that have that. So, all right, thank you all for staying on. I know we've gone over a few times already on these calls, a lot of great content and information to share with everyone. If people are going to be at the AOPA Assembly in September in just a couple weeks here, feel free to drop that in the chat. Would love to see you guys in person, and look forward to our next call. So we'll be sending out quite a few documents after this. I know we shared a good amount, but we'll get you those links and files so that you guys can further use them. So thanks again, everyone, and feel free to reach out with any questions that you guys might have after the call. All right.
Great work, Nicole and all.
Thanks, George. Thank you so much to NAOP as well for all of your help, and to Peter.